to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice. On the Texas flag, I pledge allegiance to thee, Texas, one state, under God, one community.
Didn't get any citizens input, no consent. Number 1, receive update from local health authority. Dr. Wells, you're up.
We used to have mosquito spraying program here, but this was a long time ago. This was back in the 60s. So boy, I remember that. Yeah.
Well, that's probably pre most of us other than Bill and Ronnie.
Speak for yourself.
I just wanted to point that out, Doc.
That's for sure me.
Railroad, and I assumed that it was city, but it stopped right at the city limits. What we had, Dr. Williams contacted me and said he was trying to set up a mosquito surveillance program for the college, San Diego State. And he wanted to know if the city or the county would be. I said, well, I can talk to the commissioner and see. Dr. Sullivan, who's the veterinarian with Region 6, he's over there kind of over our district. He said happy to help and stuff. That's communication with them. He'd help me train our people. Questions I have about it is number one, if you look at get a weekly mosquito surveillance bulletin from Department of State Health Services, and it lists the counties that test, which there, I want to say there's 21 counties that test. Most one is Montgomery County. The numbers that they're getting positive are not very. I'm going to try to find that off on my computer, and I couldn't get it to get it to work this morning. But anyway, kind of scattered all through the state. Usually, it's the bigger counties. We would be one if we were to participate. We'd be one of the smallest counties to participate. Active. Montgomery County. Theirs and see if theirs is like because if you just get a surveillance didn't do anything except possibly tell you if you need spray. I did talk with doctor's offices in town, a couple of bigger clinics, and they said they had not seen any mosquito-borne disease in a couple of years. So, you know, if we participate in this, I don't think we should participate unless we're willing to go forward with the enlistment schedule of spray and stuff. If the numbers predicted. Now, if it's worth it or not, I also worry about spraying more stuff in the air. And by the way, the data that I've read on it has made it look like the abatement is pretty safe. They use 1 to 2 teaspoons per acre on an aerial spraying thing. Most people, I don't know of any county that's actively spraying right now. I haven't talked to all of them. But anyway, that's kind of what I know. If you have any questions, I'll be glad to try to help. Dr. Sullivan is a really good help down at the Houston office of Department of State Health Services. And I know some other doctors down there, and they've always been pretty helpful. Questions we have, they would provide training. They would do testing for free. We would be able to traps out, collecting them, having them shipped. Then overnight, getting cool specimens in Houston. They would like for us to do. Thank you. And anyway, that Dr. Williams had kind of put a guessing question that makes it a modified program. It didn't test quite as often. He was asking instead of having, but they normally like to have at least 4 sites they test at. And he was wondering if they could ask to 2 And he said that would be acceptable. They can make a modification for that. He didn't break down even what the cost would be. I don't know much about mosquito sampling, but they do everything from dirty water to, dry ice programs. And, also they have a proprietary bait that they put in it called a sentinel trap. There's some effort that would have to be put into this. It possibly work with the college. The college, they've got an entomologist up there that apparently has expressed some interest in doing this. And I haven't been back and talked with Dr. Williams yet. Anyway, I just kind of want to let y'all know what I'm doing. I couldn't make any commitment till I talked to y'all. And like I said, I don't know. That we haven't seen, as far as I know, we have not seen a problem with any mosquito-borne disease in Walker County at this time. Did have a patient probably 7 years ago in my clinic that ended up having West Nile. I didn't pick it up. I sent her to a smarter doctor. Said, look, I don't have the, we need to run some special tests on you. And they ended up picking up that she did by doing special tests in it, and she did have West Nile. She got well. But there's no specific treatment for it. Their medicine, sure. It's just basically supportive treatment. Some of y'all who have horses may know they have to test for the equine encephalitis and Western equine encephalitis. About 9 mosquito-borne diseases that they test for. So that's pretty much what I tried to go by the state health nurse and talk to her about it. I able to get in with her. I tried to call the city 3 times. I can't get the city manager to turn my calls.
The new city manager.
Anybody got any concerns on mosquitoes?
Yeah, I mean, I don't really have any unless we're having problems, Doc. I mean,
Yeah, that's kind of what I was going to. I was going to get a hold of a couple of other bigger clinics and tell them if they start having a problem with it, let us know.
yeah, I think
Yeah.
at that point, you know, you probably would bring it back to us, but
And you're staying on top of it, so.
Well, I'm doing what I can with it. Like I say, it seems like at one time I had a little more, well, I can't get people calling back.
Houston wanted to take lead on this and do some of this testing around the college.
Yeah,
They don't pay for it.
That would be,
They probably don't
that would
pay
be
for it.
a good thing to do. I mean, they can have one testing site right there by the Sam Houston Museum, that little pond they got there.
Yeah,
That would be very convenient. Probably get a site somewhere in the city. Someplace. It could be a project for one of the students in one of these knowledge classes.
well, you know, it's unusual that it's just wet, but it's drying up quick. I mean, it's, so. I think as long as you're watching it, I'm good.
And, well, and I personally have not had anybody complain to me about mosquitoes or mosquito bites or anything like that. Yeah.
yeah, I think that'd be good just to wait and see if we have trouble. If we have trouble, then we'll look at it. That's kind of where I'll be. You know, and you'll know, I mean, if you start having trouble.
But like you said, if Montgomery County's numbers jump up, then.
Yeah.
I'll keep watching those. I think Brazos County also does some, Montgomery County actually had some positive cases in mosquitoes. If they test
Yeah.
mosquitoes, they also throw in, if any people come down with it. And so far, the numbers on people have been extremely low. And number on mosquitoes.
Yeah.
You gotta, when you
Bring all that same.
you have to do it. Multiple types of mosquitoes, because some mosquitoes carry one virus. Mosquitoes carry others. Anyway,
Well, we'll just hold tight then.
that's all I got, unless you have.
That's it, unless you got something else for us. All right, just keep those numbers watching.
Thank you, Doc.
Thank you.
Doc. I did call you back, Doc.
All right, number 2, discuss take action to authorize resolution 2025-84 for cybersecurity grant 5220601. That's my motion.
Second.
Moving second, all in favor, raise your hand. Motion carries.
This is Dan.
Hey, Dan.
Sorry to interrupt. I did notice that on my attachment for this one, the title is incorrect. I do have an updated version. I printed out 2 copies to drop off for the signatures, but I did want to notate that resolution 2025-84, it says incident response plan. This one should say, cybersecurity assessment for the title.
Okay. But,
It
Okay.
doesn't change the agenda item, though, does it?
no,
No, the agenda item's name is correct. It was just the title on the backup on the resolution
Okay, yeah,
itself.
all right, we're fine with that.
okay.
Sorry about that.
That's okay. Number 3, discuss and take action to authorize resolution 2025-85 for cybersecurity grant 5221101. That's my motion.
So,
Moving seconded, all in favor, raise your hand. Motion carries. Number 4, receive certified estimates and receive preliminary calculations of the non-new revenue tax rate and voter approval tax rate in Warren County Appraisal District.
An update on that, the county did receive, on the 25th, the certified roll and the backup. The calculated tax values is expected to be completed today, so just wanted the court to know that we're on hand. Packet that's been handed out today, copy of the certified. The effective tax rate calculation will be done early this week. Hopefully by the end of the month. It may be sometime during this week. And when we get that draft, we'll send it out to the court for your.
Be ready for next quarter.
The expectation.
But anything on 4? Yeah. Number 5, discuss and take action on the award of C2360-25-006 engineer architect services for DRRP grant services.
Cheryl and Laura are on.
Okay. Who's taking the lead on that one?
Oh.
Laura?
Laura?
Good morning, Cheryl.
Morning. I can barely hear.
You can barely
Cheryl,
do
are
it.
you there?
No.
Yeah.
Just a moment, guys. We're having technical difficulties. Okay, we're here.
There we go.
Good morning.
Morning.
Good morning. So with this was the solicitation for the engineers for the DRRP grant. And we have not awarded the engineer services as of yet. I took it to court, but we had elected, or y'all had elected, excuse me, to defer the award to a later date. And I was thinking that with all of them, the grants and stuff getting awarded, that you guys needed to decide to make an award. So I was bringing it for y'all to determine the scoring. GLS had 95.33 scoring, and Blau was 93.55 scoring, according to the evaluation team. And there were 6 or 7. Hold on, let me get my folder.
Any of y'all sit on this team?
That's
Yeah,
what I was.
7. Got it. Yeah, we received 7 solicitations at that point in time. But there was a big break between the 3rd and 4th vendor, the scoring, and that was Schoenberg and Polk, or better known as SPI.
Grant is this for?
The one we're talking about today, the DRP,
The bottom one down there.
the 4 million, the $2 million ones.
Cheryl, who sits on that scoring team?
That was Bill Doggett, Colt
David.
Christian, and Andrew Isbell.
This was like months ago, I'm guessing.
Y'all did this before Christmas.
Yeah.
We didn't know if we were gonna get the grant. We didn't get the first round, so that's why y'all tabled the engineering, because we didn't think we were gonna get it. It came back in January.
Go then.
Yeah, my only concern with it is that if we looked at that evaluation back then, I don't think the information or the knowledge that we were gonna probably go to existing projects that we had and basically just tie on to the end of them and go, because that would have changed, who I would think. So, that being said, if we're making an award today, my motion would be to award it to Blile, because they're the ones doing the first 5,500 feet of what's going to be a 7,200 foot project for me, basically. They're just going to tie onto the end of it and go the other way. So it'd make any sense to me to start all over again.
Well, I'd have to agree with Bill on this. Johnny's doing a project for the drainage in a more low income areas. He's doing all the drainage. I mean, we're gonna have the surveys, we're gonna have everything. This would tie on to that. Once the drainage is fix the roads. I mean,
Yeah.
so I'd have to kind of agree with that.
Just second it.
Just on
Let's
that.
vote.
So second on that.
I don't disagree with that either, honestly. I mean, you've got one already there that's gonna be there, so.
Right.
You'd hate to split it.
I got a motion and a second. All in favor, raise your right hand. Motion carries.
Okay.
Number 6, discuss and take action on resolution 2025-86, authorizing the award of engineering architectural service provider contract for disaster recovery reallocation program. To go to Blum?
Yes.
You probably ought to state it, do it.
I make the motion approving resolution 2025-86, award engineering architecture services to Blile Engineering.
Second.
Moved and seconded. All in favor, raise your right hand. Motion carries. 7, discuss and take action on projects DRRP 301-1450 and DRRP 301-1451.
And Roxy is on.
Can you hear us, Roxy?
Yes, I can. Good morning, Judge and Commissioners. How are you?
Good.
So I know y'all have kind of discussed this already amongst yourselves, but just to reiterate, this is for DRRP. These are reallocated funds coming from old disasters. This is actually from a 2016 flood disaster that the county was awarded. There was some deobligated funds within that, not within y'all's project, but within that fund across the state, whoever was awarded. So with the deobligated funds, they've put it into this DRRP, which is a reallocated fund, meaning there's a little bit more strict guidelines for these and a really quick turnaround. This grant is actually due August 20th. So we only have a few more days to put this together, and thus have recommended that we do projects where we already have surveys. And I know y'all know where the surveys are. I could show you a map if y'all want to see that, where we have surveys, but basically each precinct has surveys from your MIT-MOD grant that we're working on as well. But as far as the MIT-MOD grant, there were already street improvement projects done. This DRRP fund is specifically 2 applications. It has to be 1 project for each application. They're $2 million each. There's a $200,000 match from the county on each, and it has to be street improvements. So it's really, really honed into what the GLO wants y'all to apply for. But it really is y'all's decision on which projects y'all actually want to do. We've kind of looked at all the surveys in the area, and we've determined that because in, I believe it's called the Wood Farm area, there's the Riverside Harbor area, and there's the Forgotten Forest area that have surveys already that don't have street improvements connected to them just yet. It's mostly flood and drainage projects there from your MIT-MOD. So we could come in and do street improvement projects with these DRRP funds. So that's kind of the recommendation, but of course it's the Commissioner's Court decision on which projects to choose.
Y'all do know this is gonna cost you.
Oh, I know that.
Yeah. Let me point out how much it's gonna cost you.
I'll let y'all work that out.
We got it worked out, don't worry.
Yeah, we can handle our end, don't worry about that.
Yeah.
They'll pay in the end.
Yeah, and it kind of goes back to what we just said. It's, we're already out there, we're already doing it.
Yeah, I would say let's just go with kind of what
Yeah.
recommended and let's just get it going.
Especially since you ain't got, but what, 18 more days?
Yeah.
18 more days to get in a 2-month, 2-year turnaround.
Yeah.
That's tight.
They're going to be 24-month contracts, and they're very strict on that. No extensions will be allotted for these funds. So we have to finish the projects, and that's engineer design, environmental. We're already kind of doing environmental for these areas, so we're kind of ahead of the game on that if you choose these, and that way we'll have enough time to do the construction. And
Johnny, you gonna get this done in 2 years?
Sir.
24-month contracts,
Oh,
right?
right answer.
Well, I mean, and that is a legit concern I got. If we're stacking this on top of the drainage project, if we're got force, where are we at?
If you can't spend it, I'll put it all.
Surveys done.
Uh,
When I get the topographic surveys done, and then geotech will be gone.
What about the match? How are we gonna handle that? I mean, I'm sure it's coming out of contingency, but are they gonna require it up front or?
Yeah, we paying like all of it up front and then reimburse at the end, or is it as we go along?
It's usually we do it as we go along. It's a reimbursement program. So as the invoices are coming in, we submit those to the GLO for reimbursement. So it's and basically it's a percentage by invoice when that match comes in. So
But can we do in-kind services for that? Like if the county's gonna do the work, can we use in-kind services for our match?
it's allowable. It's allowable. It's a lot of paperwork, but it's allowable. Yes.
Exactly right. That's what we're gonna do.
Yeah.
I mean,
Well, that's why I was asking.
That knocks out the 200 on
I
top.
didn't know if you were gonna contract it or if you were gonna do.
No, we're gonna build ours. Well, right now I'm saying we're gonna build ours, so
May not.
that's a lot of road for $2 million is a lot of road. We'll probably split some of ours up, depending on what we got. We may do some and let others do others.
Well, and time too, I mean.
Yeah.
Never
Yeah,
know.
we got 7,000 feet of wood farm to do.
Yeah.
We got a lot to do.
Start laying down asphalt, so let's burn that up pretty quick.
Yeah. Yeah.
Sounds good.
All right, so I guess my motion would be to approve projects DRRP -301 1450 and DRRP 301 1451. Projects to include Wood Farm Road, Riverside Harbor, and Forgotten Forest.
I will not give you a second on it.
Hang on just one quick second. On your map that you've got where all the surveys have been done, my biggest fear is getting finished in 2 years. Should we make the motion that precise or back off to approve it? And if there's another road that's already in the survey area, we can add it later, or can we just add it later if we make this motion that precise?
I would.
Got 16
Within
days.
the areas within the wood farm area, or within the county? Is that an extra road? Is that what you're saying?
I don't know what's already had all the surveys and stuff done on it. We
So
ain't
the
about
sur-
surveys. We're talking about the income surveys.
Correct. So in Forgotten Forest, the entire subdivision is obviously surveyed because we're doing work in that whole area. In the wood farm area, it's not just Wood Farm Road. It's like Frank Cloud Road is all surveyed. Wood Farm is all the way up through. Oh gosh.
How about we just say roads connected with the 2016 flood?
Okay. Or we could say
It's got to
Wood Farm
tie back
area.
to the 2016. Yeah, you can still do the area, but
2016 only.
it has to be tied back to.
Has to be tied back to the 2016 floods.
Yeah, that list to give you one.
This is 2016 here.
Yep.
I thought it was several years.
Nope.
No.
There was multiple grants that we went in for.
Yeah.
We got the 2016 flood. They're still giving out money. They may get one in 2 weeks.
Yeah, and y'all won't get none of that.
Yeah. 'Cause
Yeah.
then I switch over here to this side.
Yeah, because Wood Farm.
Hey,
is
the big
still-
grant's coming, by the way.
Yeah, Wood,
Yeah, they'll probably get 10 million.
Wood Farm proper is not on the
We give in
2016.
to.
No doubt.
But it's in the area.
Yeah. It's in the area. Yeah, Yeah, we'll say roads in the Wood Farm area.
Yeah.
We'll say that. Yeah, roads in the Wood Farm area, Riverside Harbor subdivision, then however you want to word it.
Roads in precinct 4 that were affected by 2016 flood.
Roads in precinct 4 that were affected by 2016 flood.
And roads what?
That were affected by the 2016 flood. Just make it broad.
And that's from
What is that?
precinct 4.
Yes.
Yeah, I'm just trying to make it not quite so specific.
Yeah, I almost want to change my wording to that also.
Not Bill, you're in.
I
You made the motion.
Yeah, but at that time, she was talking like Wood Farm Road was a primary road, but me not seeing it on the list makes me a little bit nervous. It'd be that specific to name a road that's not on there,
So
so
do yours the same.
I'm gonna do mine the same as Brandon's, make the motion to approve 14 DRP 301 and 1415 DRP 301, 1451 to projects affected within precinct 3 and precinct 4 during the 2016 flood
There
events.
you go. I'll do a second.
Got a motion and a second. All in favor, raise your right hand.
Reluctantly.
All opposed. Motion passes.
Did anybody oppose?
No.
I was really when I said.
Okay.
Budget workshop, review budget.
Okay, you should have new packet today. This is what you have seen before. Page 1 is a summary to date of all the funds. It shows the proposed budget, last year's budget, and actuals for the current year. Prior years. Page 5 is a graphic display and listing of the supplemental requests that board has reached a consensus on to date. I'll let you just glance through this list and see if there's any specific questions you have, unless you want me to go through them one by one. I would.
I don't need line by line. I have two things I want to talk about real quick. One, it's definitely not additional. I'm going to die in. I think the medical insurance, 100,000 is an expense we could do without, but I think I'm pretty much in the minority on that one. So that's just my statement, but I'm not going to.
Amy is prepared to go through her proposed change to the personnel policies if you would like her to do that.
I just need your clarification. So when I bring back the policy
Talked about it.
time,
I thought we said no.
I know
No.
exactly what.
I thought we did too.
When I did the initial proposal, we did for everyone hired after October 1, 13.
No, that was-
To do the 25 year, I think that number hasn't been, going to be 20.
Amy, you want to come up here?
Was that,
I thought she was on the phone. I didn't see you back. Like I can barely hear her.
was that the consensus, or do we?
Well, I was talking, so I only know what y'all was talking about.
The $100,000 for health insurance.
Oh, yeah, I was on.
So when I originally presented the change for everybody after 10-1 of 13, what we had put together said 25 years. Did y'all want that 20 or?
I'm at 20.
Yeah, I think if we can afford it, we do 20.
I don't think
I don't
anybody
think-
after in 14 is any different than anybody worked here in 13.
I'd say 20.
Well, and the only reason we went 25 is we didn't know how the numbers were gonna play out.
Yeah.
So, I mean, if we can knock to do 20, then we need
And then we talked about pausing it if you got insurance somewhere else.
Yep.
Is that everyone or the group that's being added after the 10-1 of 13?
after.
Everyone.
No, after. So totally different deal from the deal we had. You gotta keep them separate. They're gonna be separate bills, in my opinion.
I would think they'd have to be separate, really.
I don't care.
I mean, I guess it really don't
I
matter.
guess I'm not up on what I mean. If I leave here tired of bills and nonsense, then go to another job, does Walker County become secondary under the 13 previous?
So you are grandfathered in the prior 10-1 of 13. So if you left now, went, got another job. And regardless of what our change is, if we make a change or not, if you go to work somewhere else and you have insurance through your current employer, theirs is always primary. So this one will become secondary. So same thing, you leave now, yours would become secondary. Your brand new employee we hired last week, he would fall under a new category. If he worked 20 and left, went and got insurance somewhere else, we would pause his because he has the insurance at his employer. We would pick this back up whenever he lost that coverage.
And the reason for that is because we're paying that $1,000 a month,
Right.
you know. If they've got insurance somewhere else, let them cover it. And then it gives them the option to pick it back up once they retire, leave, or get fired, or whatever.
The $1,000 doesn't get reduced as a secondary insurance.
Yours is different than what he's talking about. He put the second part.
Right.
No, your 1,000 would be the same.
Yeah, if you have coverage, it's the same price whether you're using it every day or
But when we
Never.
put it on pause, what does it cost us?
nothing. Because we're not covering it. So you would go from having potentially 2 insurances to just the one with your current employer. Then when you left, that one went away, we'd pick this one back up.
I'm thinking I'm good.
And-
with
and that
pause.
keeps
That's
us-
gonna be-
Yeah.
Yeah, that keeps us from paying that $1,000 a month on somebody that's got insurance somewhere. You know, it's a savings for the county. A lot of them, I think, we look at Montgomery County does it away completely,
Right.
Yeah.
you know, I mean, so
Most of them.
this is still a heck of a benefit.
Yeah.
To be able to pick it back up later down the road. In my opinion.
How in the world, I mean, that's gonna be a heck of a thing to plan for and keep up with and
And the only way, every year when we get our new rates, I send a deal to the retirees telling them what the new prices are gonna be. So I would have to include a sheet. Hey, if you have insurance, certify you have it. And it's gonna have to be an honor system because I don't know if you have it or not. So you would basically have to tell me to stop it and then tell me when you need it back.
That doesn't affect open enrollment. I mean, because it's an event, it's a live event. So if they went and needed to put it back on, they wouldn't have to wait till October is what I'm asking.
You're kind of budgeting for it anyway, so you pause it, I mean, it's a savings. for
Yeah,
the
it's a
county,
savings.
So it's kind of the way I look at it.
I wanna have enough money, but I don't wanna look up in 10 years and have $10 million in there when we need 2.
Well,
Use the number.
and so that's part of this, just like ours. Later down the road, we can back off on this. You know, if Trish's numbers works out, you know. Once you
If we
build it,
follow the same pattern, we would continue to budget it in the tax rate. But if the money were not spent, it would roll back into general fund, but it's always still funded by the tax rate.
Yeah, and that's important to keep it there.
that's what happened
Yeah.
before, is they didn't fund it at all until about.
Hey, before we get off benefits, I still got a issue with the judges upstairs employees that work for other counties besides us. And while Amy's here, do the other counties pay a portion of the insurance on these employees, and do they pay the matching retirement? Do they participate? They do?
Yes, they do.
Okay, so they're paying a portion of everything that goes along with it.
Of the 2 employees that work with their department, any other employee in the department that's not one of those 2 positions, of course, is paid 100% by the county. But those that work with and in the other counties, the two that the increase was asked for, their percentage of 100% of the benefits is billed to them also. So yes, they pay their percentage share of the health, of the retirement, of the workers' comp.
I think the numbers were 65 and 66%. We
Yeah.
pay that.
They vary
The
by-
counties pay the other.
But the court, that has asked for the increase, it's about 65%. Walker County pays about 65%. And then the remainder is billed to the other counties based on population, and that's a statute.
So did you visit with other
I did.
judges?
Leon County's doing 3,000 across the board. Nothing else. It pays their health insurance and everything. Madisonville didn't know what they're gonna do yet. And Grimes County didn't know what they're gonna do yet, but they're having to give $1,000 and something just because of the health insurance cost. They don't have a clue what they're gonna do yet.
I was told Grant about it, and it was doing 3%,
Which one?
3% COLA,
Which county?
Madison.
Madison.
This
Which
is what I
ranges
got on the email.
5,
Yeah.
you know, so theirs is different too, which I don't totally agree with.
So I'm still against, I don't think we voted for the salary increase on court coordinators or court administrators.
This is still a consensus. You can
Yeah.
change anything that's written on this page.
Talking about on the coordinator and the administrator.
Yes.
I'm a no vote on those.
It's on this page. On the 12th. right?
It is listed as part of the consensus items. Yes.
Yeah, I'm for the 2.5. What did
Yeah.
we give? 2.5.
2.5.
I'm for the 2.5 and that's it. That's where I'm at on it, but.
2 against.
I'll go with you. I think, you know, if Madison County did do 3, and then, I mean, they kind of got a gun held to their head too, in my opinion. And so, you know, I think they ought to go with what we've got.
Yeah.
Being as we're paying, just the one
The
we're
bulk
paying
of it.
55% or 75%.
It's either 65 or 63. They're both
Yeah.
close.
We're only talking about the coordinator and administrator.
Yep.
Correct.
No, we could have just down below to.
We're negotiating on those.
2 point,
So,
Yeah,
Would
it's
be
set by them.
Yeah.
like they are.
So, cause that 2.5% should be, it's on the first page under.
Yeah.
It's over here. Okay. Take them 2 off.
okay, consensus of 3 to remove.
Yes, ma'am. Got 4, Bill. You want?
Oh, I'm
put your
good.
2?
Yeah. No, I'm good.
That's 5.
I'm fine.
Okay. Okay, and the transport deputy is also included in here. I thought we had a consensus on that one.
Yeah, we kind of waiting for numbers to really,
I think it's gonna be in there.
yeah, think so. I mean, I'm beat for it. I mean, just put it that way. I think the sheriff needs it.
Yeah, I'm for it as long as we can get
You can figure out how
our
to fund
goal
it.
at the end. Yeah.
And then my other thing on your auditor was you took money from your regular budget and moved to salaries for that?
Yeah.
Do we allow any other department to do that?
I don't know that any other department has asked. I mean, I could have asked for the money, but
Right,
I did not want to cause any increase in the tax rate.
right. I just know we turned down everybody's other pay increase to everybody across the board, and we just voted down the district judges. I just don't see where we can allow one department to take from their regular budget and put in. That money should go back to, if you have it extra in your budget, it should go back to the tax rate and help fund something else.
Yeah, the order has already been signed by the judges. If you'll remember last year, I asked for reclassification and the judges approved it, auditor 3s to 4. I did not ask for enough money to budget those at midpoint again, because I did not want to have an effect on the tax rate. All this is doing is moving those 2 employees to midpoint. It is not going above midpoint. They will not make above midpoint, but this puts them at the same budgeting method as every other employee in the county. It is
Yeah,
not giving.
And they need to be at midpoint.
They need to be.
Yeah, they need to be there. I don't have an issue getting them there.
Yeah, that's all this is doing, is getting them to mid. It is not increasing their salary above mid. And quite frankly, I don't have anybody in that position because I'm not able to fill them with the salary rates I'm advertising. So this allows me to advertise up to,
So the reality, you saved us money anyway.
yeah, right now.
And you pulled, you had the money set, you pulled it from where, you said?
I'm sorry.
You pulled the money from where, operation?
The difference between what they were budgeted and midpoint from purchase services within the county auditor, the 21010 budget.
Okay.
Yeah, it's just bringing them to midpoint, not taking them above midpoint.
Yeah, well, I think it's important to get them there, whether we pull it from your budget or wherever we have to pull it from. Because everybody needs to be to that midpoint.
We can get by if you pull it from this budget. I think it's more important to get them there than to have that money in purchase services.
You okay with that code?
Get outvoted, so it's all good. I'm just making,
Yeah, we gotta get them.
Across
there
the board,
somehow.
but yeah.
I mean, regardless of where you don't pull it from there, then we need to get them there. Somehow.
I get it, but we argued the case for everybody, so.
Yeah.
That was on behalf of everybody else we didn't give a pay raise to.
I think in most of those cases, all that I remember, they were moving above midpoint.
That is true.
Okay, then my second one that I want to circle back to is our paramedic pay. We talked last week and we brought up, and we've looked, I don't know if y'all had your chart here or not. I think we had it on the screen. It shows our paramedics making 60,000 at entry, 71,287 at midpoint. I wanted to make a clarification on that, just so we kind of know what we're talking about there. This salary, 60,606 to 71,287. The rest of this entire sheet, non-EMS related, is 2,080 hours to hit these salaries.
Where are you at?
I'm on, this is on the, I think that's back in here somewhere too, on the paper you just gave us today, right?
Last week's.
I think our salary stuff is in here.
Yes, keep in mind that
59. Annie.
all of the paramedics are not being at midpoint. They are being budgeted at significantly higher than midpoint.
Just because of the overtime that they
It's
paid.
because of the 3 hour, not 1 hour slash.
Right.
So the amount that's being split, like you say, Commissioner, among the hours is not that midpoint value.
Okay, but what it is, that number, let's see what, hang on a second. Is that salary number. Let me just back up here. I'm trying to find it again here. Not done here. It's on the back of page, is it page 60? Yeah, page 60. Number 113. That salary is based on 3,334 hours of them working. Their actual salary rate, what we hire a paramedic at today, is $19.50 an hour, less than $20 for paramedic. That's what we're paying, less than $20 an hour. They make
Just one point, what we're paying of it, $8,403 an hour. 82,403 divided by the 3330 per hour.
so
Not arguing against the 100,000, just want the facts.
You got to be lost.
yeah,
So we're on 113A.
on 113, just 113,
Yes.
the EMS in charge attendant paramedic.
Is 82,403.
Okay, so $24 if you do it that way, but that is overtime, and that's them working 3,334 hours in a year. Everybody else on this sheet, except for EMS paramedic, works 2,080. So these people are working 500 extra hours. 500 extra hours. That's 10 hours a week. 10 extra hours a week to make this salary, 10 hours a week. So it's not a 40-hour week, it's a 50-hour week for these guys to hopefully make this salary. Not the entry level people don't make that salary. Montgomery County, and we surveyed, Rachel sent out, I don't know if she's on the phone or not, but she's not, okay. She sent out surveys to request to every county around us to send us their information. And we got one reply with Waller County. They work the same schedule we do. They pay more than we do in Waller County also. Anyway, the big difference is Montgomery County pays more right out of the chute. They have 4 shifts. We have 3. And the important thing about that is that they work 2,500 hours a year in Montgomery County and make $10,000, $15,000 a year more than we do. That's why we can't compete with Montgomery County. They work 500 hours a year less and they make $15,000 a year more right out of the chute. How do you compare with that? And their schedule is, they have huge time frames off in between shifts. Ours are 24 on, 96 off, 24 on. You're always on the clock here. And then you're on call when people call in sick. So,
Bill, how much of that 500 is overtime?
well, it's scheduled overtime. That's just that's how they have to do it. I'm not familiar enough to know all that, but generally 2,080 is your no overtime number. That's 40 hours a week, 52 weeks a year. So they're telling you when you're coming in, you're going to work 1,300 hours overtime this year. That's your job. In order for you to make a living wage, you got to work 1,300 hours overtime. I mean, I don't think anybody in this room would sign a piece of paper to say, I'll volunteer for 1,300 hours a year of overtime and come on to work for you for $19 an hour, basically, or $20 an hour with a paramedic. You know, the one you want to pull up in a $350,000 ambulance and save grandma, basically. You know, you want somebody that knows what's going on and has the skills. And the way you get the people to have the skills and to stay is to be competitive and hire competent people. And both of those take a competitive salary, and we don't have it. And we ain't gonna solve all of it this year. But what I brought 2 weeks, I guess last week or maybe even 2 weeks ago, is to put $1 on the 31 people, $1 an hour on that, say we did something, and then put a comma. But I think it's also time whether we can pay for it out of project contingency or something, but I think we need to revisit our salary study evaluation. And we know we got 60% of it right, probably the first round, but I think we need to go back and circle back and do a revision, a tune-up on it, and look countywide again.
Bill, you done lost me. You want to catch me up here?
Okay.
All right. You're looking at 113.
Mhm.
In the middle is 73,582.
Yes,
Is that what we're looking at?
that's what you're looking at. They have to work.
And you're saying we're paying them $19 an hour.
They have to work $3,334, 3,334 hours to make that money. They have to work 1.6 days for every day that everybody else works.
But that's a regular shift, right? With nights.
But how much of that is overtime? Because
It's
there is a lot of
scheduled,
overtime.
yeah, it's scheduled overtime though,
That's-
because they work
That's
longer.
their shifts. I mean, that's
They
what
they don't work 40 hours basically.
but they're away from home for all this
Yeah,
time.
and
Brings that number way up
Brings what number?
per hour.
Yeah, but you pack up. I mean, that's the deal you make, because you leave your your husband, wife, kids, or whatever for 48, 56 hours. Then you come back home, and so you're on the clock. It's not like, hey, I'm only on 8 hours this day. You're 24 hours. You're 48 hours. You are on the clock those days. So it's not a matter of they're away from home, but they're not
You're comparing us to Montgomery County
or Waller. We can do
or Waller, either one. But I mean, if you're going to compare salaries, then compare workload.
And cost of living.
Yeah.
We talk about we can't.
$10,000 difference to me is a lot of money. Don't get me wrong, but is it enough money that I'm sitting in a box for that whole time and not getting a break at all? I mean,
well, once again,
And we got people driving. So here's We got one who works for in White House lives there, Woodlands, Tomball Spring, San Marcos, Rio Hondo in the Valley.
Mhm.
5 in College Station, 2 in Centerville, 7 in Conroe, but Montgomery pays way better. And we only have 10 local people. The rest of them drive in, but we're not
Or-
competitive with the market.
Or they drive out. You left off the who's driving out route. People who get paramedics here that leave here. If you're gonna have that list, you gotta have the other list next to it of people who don't
Do
stay
you have
here.
that list?
I don't, but
I don't
here,
either.
but the 6
Um,
people we're down right now went somewhere. They went somewhere.
So
25,
how
25%.
many hours do they work for this?
We're down 88 people in that department since 2021. We're down 24 and since 25 people since 24 when we gave them a pay raise last year.
Yeah, because we don't pay enough, because we're not competitive. Why would you work 3,334 hours when you can go down the road and work 500 hours less and make $15,000 a year?
Do these
Why would you
people
do
in
it?
Conroe know that come up here?
Most of those people here probably part-time. They're not full-time. I'm assuming probably part-time, and they come work part-time here, part-time there. You know, they come and on top of another job that they're working a 3 shift, so they have 3-4 days off, so they go pick up a shift someplace else. And as a part-time job.
Well, if you're doing that, you're not worried about your family then as far as I'm concerned.
Yeah.
I mean, I'm not saying that, Bill, but I mean, I've worked 2 jobs ever since I can remember.
Well, me too.
And our
But our people-
families pay for it.
Our people
know?
don't have the ability to go work a part-time job someplace else because they are 48 on and like 48 or 96 off and then 48 back on again. These other people that are driving up here, like in Conroe or Houston, it's like 2 days on, 4 days off, 2 days on, 3 days off, 5 days off. So they have time, and almost all of them go pick up part-time
Well, I
shifts.
think we tried every shift schedule since I've been here.
They're trying to figure out what the hell it's going to take to get these folks to stay. So, hey, we can't pay you. What can we do to make you happy? And they're like, hey, we're here. Let's spend the time that we're here. And now when you have 3 shifts and 25% of your workforce is gone, now you're looking at the rest of your people like, hey, we're either not going to man a truck, which we're not doing a lot right now, or you're going to work a bunch of overtime. And you're already working 3,300 hours a year. So you're going to say, hey, person who just got off a 48-hour shift needs you to come in tomorrow and work 12 more. I don't think we're doing our job if we just say, gosh, I wish it was better, because your 25% of your workforce is gone. And the numbers I didn't have all those, but that's scary. If that many people are coming in and you're hiring them and they get trained and they boogie out of here, you got to dangle something in front of them. You got to make them want to stay here.
Oh, this list has not changed. I don't know. I hadn't seen this list, but last year when we pulled the $3 time, I pulled a list that was comparable to that, and it was still, everybody was outside coming in. It wasn't, you had a few of the old ones here still, that were that they were in so deep that, they wanted to stay or were committed or whatever.
Mhm.
Now, I'm assuming some of them have retired. I know a few of them have. But there's still a lot coming from the outside.
We ain't court, brother.
And so,
But even the ones, if 25% of your workforce is gone, you got a problem.
Why are they leaving? We're told money. Ain't none of these saying money. We got a lot of them just that isn't working on part-time, resign, resignation letter, in lieu of termination, insubordination, failure to complete field training, unknown, resignation letter for family, job abandonment, didn't understand the schedule was why they left, retirement, resignation letter, family circumstances, unprofessional multi-fleet accidents, failure to complete field training, did not meet part-time requirements, unknown. I'll give you that one. That's 2. Letter of resignation, family needs, unable to pass driver's test, letter of resignation, letter of resignation, continuing education, unknown, retirement, did not pass field training, lack of involvement with department, unable to fulfill PRN commitments. That's the last, and that's the ones that have left in the last year and a half. So none of that did I read money.
This is the level of people that you're hiring. So yeah, it's all about.
I'm not hiring them.
That the county's hiring. This is the level of people that you are with your salary scale. That if I got a piece of paper and I can't get a job in Montgomery County for some reason, or I'm an entry level person, this is who you hire. And you get
You get in the bottom of the barrel, which.
That's what I'm saying. Yeah, yeah, we get that people who can't go nowhere. Or, I mean, we have a lot of people that come on board.
Well, you're saying that about everybody we still got working here then.
and
I
go-
think they're great people.
I think they're great people too. The ones that are here, absolutely. But we turn over and we turn over and we turn over. And we turn over people who are trying to improve themselves or can't cut what's going on here, one of the two. So
If they're working, how many hours did you say, Bill?
3,334.
Amy, do you have an idea of what that money wise brings at the end of the year?
So I just did it real quick. I asked who we're paying our the paramedics anywhere from $19 to $23.74 an hour. So if they're getting paid 19 at that 33 is 63,346. If we pay them 23.74, they're making 79,149.
But they gotta work a lot of overtime to do that, and you burn them out after.
They gotta work-
time,
they work-
you know.
They work 1,300 extra hours. For every hour, every day that we work, they work 1.6. That's crazy. That's crazy, crazy. I wouldn't want to do it. I'm proud they do it. I don't know the cure, but I know 6 people down, 7 people down. You can't do nothing. You can't just hope it gets better. You can't cross your fingers and say maybe some good people will show up. Because they're not. And the people who are in training or new EMS people we put on too in the last couple of months, crossing your fingers that they don't get 6 months experience and send their application down to people who, down, I keep saying Montgomery County, but that's where they go now, or Waller, I don't know. But they get educated, get experience, and now they got something on their resume besides I graduated paramedic school, and they're marketable. So
But like I said, I mean, it's been like that forever, Bill. We're a training station. That's just part of it, but in the same concept of that, we give them, and this is where I'm gonna be, and I'll shut up about it. We give them $3 an hour last year, above and beyond everybody else, $3.
So that brought them up to 19.
yeah,
Right.
got them up to 19.
So we had them really low then.
It's $16.
Brought them up $3 an hour above
Yeah.
whatever the salary study was or whatever, I wasn't in favor of it, but in the end, it was part of the budget, went along with it.
Mhm.
But $1 is not gonna do any good when you've got just as many gone now as you did last year. So the $3 didn't do any good, in my opinion.
It might have kept us from losing 9.
Maybe.
Well, we pay our operators way more than $19 an hour.
We do.
Well, I mean, we do. I mean,
Yeah.
you
We
think.
pay our pothole patchers more than $19 an hour.
He's worth 50.
Well, I'm not arguing the point that they need more money, but
Yeah.
I'm to the point that I'm not going any higher than what we've done. And what you're talking about is talking about keeping another penny on tax roll.
No, not a penny.
Yeah, I was gonna say, the cost literally would be about 0.25
Yeah,
Quarter.
cents.
quarter of a cent.
But you basically have 2 options. One, you could add that to the tax rate. 2, there is money and fund balance and EMS. You could fund that out of fund balance and roll it into the tax rate next year, whichever option would work best for the court.
Well, I'm out on that one
Yeah, me
too.
too.
We've done that before and that comes.
It hurts
back
next
to
year.
bite us.
It hurts next year.
Yeah.
Not only-
Yeah, that brings the next year a tough start if you have a hard
It does.
year.
Yeah.
And I'm gonna tell you, I don't disagree with Bill. We ain't paying them enough.
Yeah.
Paramedics.
Yeah, I'm not arguing that.
You know,
No, I don't disagree that, but you can only do so much.
Yeah.
But you can't just say that. You can't say that's all we can do. If it fails, it fails. You can't, our business, and that's why it's on the government level, because we don't let it fail. We can't let it fail. We put out to people, hey, we're in charge of your EMS. We're going to give you a quality product. We're going to make sure that it's run right, and we're going to do what we can to keep it fiscally solvent and have it staffed professionally. That's our pledge to our citizens. Not, man, can't
Well,
believe it.
yeah,
Can't believe
I
that.
mean,
But until you can prove to me that it's money is the problem, then I'm not on board. I'm sorry.
I know money's part of the problem, but working, how many hours overtime did they
3,000.
work to get that money, to get that $70,000?
1,300 hours.
1,300, that's part of the problem right there. You know, you burn them out. You know, and that's
it.
Amy, can you pull numbers on
Yeah.
what they actually make with no IDs on? Like what they made last year? Per employee? So, I mean, you don't have to do it right now, but
Yeah.
just for next quarter.
I am totally fine with putting 1/4% on the tax roll and putting $1 an hour on the 31 EMS people. I am totally fine with that. I would ask Patricia to ask us what our consensus is of that. I'll put that out there.
Could you let me know what your?
I'm a no.
I'm not opposed to it at this point.
2, 4.
I'm against it, I'm sorry.
I heard that first
Yeah.
part. What?
Yeah, yeah. You were listening.
You just get one vote.
I would like to see the end result of what we're looking at on, you know.
Well, and that, well, you won't know that till we get
Yeah.
our numbers in.
But at the,
And-
you know, today I'm not gonna say I'm opposed
Up
to
to you,
it.
Brandon. I jumped out there early this time.
Throw Brandon right in the mix.
Yeah, exactly.
Brandon, you're gonna learn to speak up a little quicker.
Something about sitting this on this end of the table.
You gotta go fast, man. You gotta go quick.
I stole
Well,
it.
neither we keep on.
Oh, Put me in a spot here.
Yeah, it was intentional.
Yeah.
I agree with a lot of what's been said here.
You know, the
We
level,
also don't
Yeah.
have the numbers in yet, right?
We do not.
So I would say that we put something together when we actually get the hard number. The revenue narrate.
One thing I wanted to bring up, and that was in Road and Bridge, and then we can come back to this, but one of the things in going through the numbers, came across a letter where the amount of money the county is going to get from the Forest Service was reducing about $100,000 each year. And when this budget was prepared, it was assuming we were going to get
What
that
monies?
$100,000.
What monies?
It's the rules,
Safe rural roads or something like that one.
yeah, the rural service roads, and it was money that from the sale of the forest lands, the counties were receiving, and they split that money with schools.
Yeah.
That expired, and so that money is no longer.
It got reapproved.
The SRS funds?
Yeah.
It was
Yeah.
reapproved.
It got reapproved.
Not in anything we can find, and we.
We haven't,
called
we
the-
just had a Zoom call on it. We got a Zoom call today. To talk about the new funding source on it.
I don't. I'm not.
I didn't get.
Or it was
because
Friday.
We just called them Friday.
I've been getting emails on it twice a week talking about how it passed. Yeah, I'll send them to you. Lonnie's heading that up.
What?
Reach out to Lonnie. She's not on those emails.
Email today saying we were.
She's not on those. I can send them to you. But I'll get with Lonnie.
Yeah,
He was
oh,
heading that whole,
so that, I didn't think that was in here.
I was gonna say, no, that 100,000 is here. It is in the budget. In this budget you've got today, it's not in here. So what I was gonna bring up is that really 100,000 of the tax rate needs to go to the road and bridge fund. And was basically going to ask for permission when we got the final numbers. Any money up to the 100,000 would roll in the bridge to balance road and bridge. But yeah, I mean, Friday when we talked to them, they said it was not approved for this coming year and that they didn't really know the status of it. So I hope that something changed.
did we get receipts to Forest Service on that 120 that they brought in? Okay,
100.
whatever it was.
So, Miss Patricia, we're gonna need $100,000 plus if we add the transport deputy. That's another 100.
That's 70,000
70.
that we need there, which general fund can well cover the 70. I'm more worried about road and bridge covering the 100,000 because that basically the only place you've got to get it is fines.
We have another full cent here for long.
You talking about?
What I'm getting at.
Bring out a,
I was helping you.
County judge law makes 166. We can take some of that. John don't get that. does he?
And like I say, I expect that there will be, some money that comes in, but both in the tax rate and that final calculation's done. But, my point was, I think maybe we would be better to put, at least 100,000, more in road and bridge if that money's available.
Do I get any of that money, Mr.
And
Patricia? I don't have any
it
It may not make me no difference.
You ain't gonna care on that.
I ain't gonna get none of it anyhow.
I don't have a lot. They got most of them.
Okay. It's probably more information next Monday than today. Should be a whole lot more information to lock things up next Monday.
Yeah, and next
I
Monday.
thought that's what we were.
Yeah,
So,
I was.
we didn't get no
thinking we
numbers.
Have enough information today to go ahead and do that. Because next Monday, next Monday, what it is next
Monday.
y'all will actually vote on the budget that's going to be proposed. The other thing we're gonna be doing is setting the date of the budget hearing and the tax rate hearing. Based on the statutes and how many days you have to do what, the proposed dates would be the 25th, which would be that following Monday. Meeting on the 11th, we would file it on the 15th, and on the 25th would be the budget hearing and the tax rate hearing. If
We have to have one of each.
one of each now.
They're just separate line.
Yeah, and we normally step them. You must have the budget first and then the tax rate, because that's the way you adopt them. And then at that same meeting, you will vote on the tax rate that you're proposing to advertise for the hearing. So all of that will take place next week. So where we are, we don't have a consensus on the EMS increase.
He abstained, so that the motion fails because it's 2-2.
It's a consensus. I'm saying it's one of them.
I'm supposed to be able to vote for you, ain't I, Brandon?
That's
Can I vote for you again?
that's parliamentary procedure.
That's a new
Well,
discussion.
the operator five, we paying them $27 an hour. And you paying paramedics 19 to 22.
But you're not supposed to be paying your operators to sleep. You do pay your,
You can up, that's what you can get them to according to the new deal
I mean, the truth.
with the 2.5% in it.
We really need to give Stacy in the appraisal district the proposed amount of increase over the NNR so that she can do the calculation, because she needs to know that number when she's calculating. So I will have her do it both ways at 2% and at 2.25, and then it'll be available
what does that 0.25 give us?
about 150,000.
About 150,000. Aren't we asking for about $150,000 for our engineer?
179.
Have we got that in there or is that out of there?
No, you're not in there.
No.
No, and that's what I'm getting at. If we need $100,000 for road and bridge general, and then we built said the transport deputy coming out of where?
29,000 of it is coming out of the estimated amount.
Yeah,
of
what we had left over.
The rest of it would be basically coming out of fund balance, or hopefully it will be coming out of money in excess of the 600,000 that I'm
Well,
estimating.
fund balance is not gonna be built in the tax rate though, right?
It is not.
And that's what I'm getting at. I don't want
to kick
that.
it down the road.
I do not want to kick it down the road.
No,
Nothing.
I'm with you on that 100%. Yeah.
No, you can't do that. We did that.
So we're
before.
100 and it
Yeah.
fit us on the sheriff's
Yeah.
step. We come
Yeah.
back next year and.
Our little stupid minds forget
Yeah,
about
well,
it.
we
Let's
had-
Patricia, don't say it.
And we had two deputies right off the top that had to come off the top.
Yeah.
So it hurt.
Yeah.
So we're 175,000 into this already that hopefully the numbers are gonna absorb to still stay at 2%.
That's
We
why
may
I
have
have
more
next week.
decision to make next court.
Yeah, next week I feel better when we have more hard numbers. We may, hopefully we undershot a lot of stuff and we're better. Or
I sure
hope so too. I don't have a feel. It's got really-
This email that Judge received says, don't worry about that kind of
Coming.
stuff.
Oh, sounds good.
I'm almost, if you're talking about the group with Lonnie and all that. It's been refunded.
I mean, we wrote letters and called and all kind of stuff to get that passed.
Unless it changed, well, unless two things. One, the lady at the government didn't know what she was talking about. She said it was not funded.
That happens a lot.
And, or something changed then, that she wasn't aware of, then we have been in the past getting a little over 200,000, about 205,000. This year so far, we've got about 130,000. Okay.
Okay.
And they've said no chance.
That was the talk about April, May. So it's changed this summer.
All right.
Yeah.
Hopefully have that news next week too. That'd be good.
So if we roll in here next week and we got some.
The other thing I kind of wanted to go over with you, everything else here, y'all seen multiple times. In the book also is all of the details of the legislative funds, begins on page 33. So this shows all the specifics there. The certified values are at the back of your handout. And then on the budget policies, which begins on page about 75, there's very, very few changes in here that I did want to point a couple out. One minor change, it changes in the department listing, the title to IT operations.
Miss Patricia, my 75 is index.
You ended at 75?
No, it's in an index.
Yeah.
Do I have the
Oh,
wrong
yes,
page?
yes, go to page, the first one I want to show you is on page 93. It's on the minimum fund balance. It did say 2 to 3, 3 to 4 is what we've been talking about and what we've been living by the last years. Just wanted to formalize that. Page 97, couple of changes there, which basically talks about the judge submitting the budget. The policy stated at the no new revenue tax rate, taking that sentence out, the judge has discretion as to how he presents the budget. So just cleaning that up a bit. Page 100, need a change related to the, says employees hired after October 1st, 2013 not eligible. We would remove that sentence and restate that a little bit that says will be based on the current policy adopted by court. And that's pretty much it. There may be everything that I missed, but very, very minor changes. And so this will be presented in court next week.
Already?
That's really all I have.
It's growing back.
All right, anybody got anything else? All right,
Job, Miss
Thank you, Miss
Patricia.
Patricia.
public comment for non-agenda items. Questions from media? Commissioners Court comments.
Do we ever,
You said no.
I can't, that was more of a nah.
You told me a while ago.
You come on with it, don't you?
Yeah.
What do we want to do with, burn ban stuff? Do we want to at some point, like on the next agenda, just place it on there in case drought between now and then? And just leave it on there until mid-September? This, because we can't just impose them.
Y'all can write a policy says we can impose them.
Okay,
I'd rather do that, because
Butch
I'm
can
wet
take
on my end.
Butch can take a consensus from the court and the fire chiefs, and then we can implement it.
Well, if we can do that, that would be great.
Yeah, all it is a motion that says you give me the power to do it, and then we'll run it through emergency management to contact all y'all.
That'd be good for me. I think we need to have it to where we can. I mean, we're getting, right now, we've had some rains that rumble through, and I don't even know what the number is right now, but we're blessed this year that it's mid to late July and we're still getting rain and stuff like that. But I almost think it's, and if we put this, we write a policy, then it becomes a moot point. That's fine with me. I'd rather write a policy than have an agenda item every week we talk about, but we need to be able to make a quick call versus, gosh, it's Tuesday and we didn't put it on the agenda. Now we're 2 weeks out and half the county's burning up while we're waiting to make this call. So we can do
Put
that.
it on and then just ratify it at the next meeting.
Nope, can't do that no more.
That wasn't ever legal in the first place.
Right.
Oh, did I say that?
But yeah, I mean, it don't take long.
Yeah.
August is 100 degrees for
Yeah.
30 days.
It can get there.
Yeah, it don't take long.
I'm a fan of burn ban when it's used appropriately, when it doesn't need to be on and we put it on, that's when I get upset about it.
Well, I'll say this though, you do it as a county. You
Yeah,
do
it's
it as
the
a county.
countywide.
Yeah, you do it as a thing, as a county.
Yeah.
Split it up, it ain't gonna
So let's-
cause more problems.
Is that something, Colt, something you look at, or does that need to come from? this?
Yeah, I'll work on that.
Okay, we do put that in place. I like that, because then it can be like, let's do it today.
I wouldn't blame him.
Yeah, you can blame me. That's right. That's how it's gonna go either way.
You're gonna get blamed regardless.
Yeah, we still got, when it was flooding, people were calling asking if it was burn ban, so whatever.
Right,
All right.
that'd be a lot better way to do it.
Anybody got